Hi, I'm Cameron Harrison,
And I'm Megan Jones.
and we're here to talk to you today about the China Study, a book that we did a research analysis on. Now, to introduce it, the thesis of this book was that animal proteins and animal fats can cause disorders in the body. And now, this has been evidenced by a lot of things. They put a lot of work into evidence in it, and we're fact-checking their basis. Now, they used evidence by estrogen, hormones, diet, and cholesterol that there are risk factors associated with breast cancer. We also used the Elgin factor and the article of influence to rate the articles themselves, the journals the articles are published in themselves, to see how they stood compared to other articles.
The first article that we took a look at was Dietary Fat Intake, Serum Estrogen Levels, and the Risk of Breast Cancer. The main purpose of this study was to prove a correlation between consumption of a high-fat diet and an increase of breast cancer due to an increased amount of estradiol. The subjects identified their research studies using Medline Plus, and they did from 1966 to 1998 of premenopausal and postmenopausal women, 10 studies for the pre and 4 studies for the postmenopausal. The studies conducted among the premenopausal women subjects changed from a high-fat diet of 29 to 46% to a low-fat diet of 12 to 25%, typically for 2 or 3 months. In studies conducted among the postmenopausal women, intervention period ranged from 3 weeks to 5 months, and calories from fat was 24% in one study, 18 to 20 in 2, and 10% in a 4th study. Serum estradiol levels decreased by at least 5% in 7 out of the 10 studies in the premenopausal women. In postmenopausal women, 3 of the 4 studies showed a reduction in serum estradiol levels. And there were also 2 studies in which the fat intake was reduced to 12% or less, and this showed the largest percent of reductions. The percent change in premenopausal women and postmenopausal women combined was 6.6%. In all studies combined, serum estradiol levels decreased statistically to 13.4% in pre- and postmenopausal women. While this study did have really good talking points, there were also limitations. There was concern in interpreting the effect of dietary fat reduction on blood estrogen levels and how this possibly could be other dietary factors. Another limitation, the information pulled was close to 50 years old and may not account for medical advancements. An important statement mentioned by an article in this study concluded, there is no evidence of a positive association between fat intake and a risk of breast cancer, and no reduction in risk even among women whose energy intake from fat was less than 20% of total energy intake. In conclusion, due to contradictions in the study compared to the China study, this article was inconsistent.
I know we'll give it over to Stephanie.
Hi, I'm Stephanie, and the article that I personally looked at was titled Reduction of Serum Estradiol in Postmenopausal Women Given Free Access to Low-Fat, High-Carb Diet. So the study was looking at 13 women, 11 of which were obese, who all came into a longevity center, which is basically a weight loss clinic, and they were given less than 25 milligrams of cholesterol, as well as 34 to 45 grams of dietary fiber per 1,000 calories, and they received less than 10% of their calories from saturated fat. So that was the primary intervention, but they were just allowed to eat in a cafeteria-like setting, and there weren't any other restrictions. In general, they lost weight, and their estradiol levels and their cholesterol, their triglycerides, HDL, LDL, their weight, everything decreased, but they mainly think that it was because of their lower calorie intake. So the authors admitted that they support the hypothesis that dietary interventions may be useful, like a good strategy for breast cancer prevention, but they need more studies to assess the potential of this approach. So there's really no direct proof that a low-fat diet from animal products in particular would support their conclusion. And I mean, even they're admitting that they need more research before they can come to a firm conclusion. So breast cancer might have a correlation to estrogen levels, but there's no direct line between the two. So Dr. Campbell's thesis that breast cancer can be evaded by a low-fat diet from animal products in particular, we found was inconclusive.
Alright, now I'm going to take it over. Now I'm talking about a low-fat, high-fiber diet and its influence on insulin, sex hormone binding globulin, and blood lipid levels. Now, you're going to hear a very similar diet to Stephanie's earlier, and this is because both of these experiments were performed at the same Princeton Research Center. So, you have 35 to 40 milligrams, or grams of fiber, per 1,000 calories a day. And then you have low cholesterol, high complex carbohydrates. And then you have protein, mostly from plant sources. You have legumes and vegetables in there to make sure you get all your essential amino acids. But they also only allowed lean meats. And they only allowed 85 grams of those lean meats, either fish or poultry, a week. And they also encouraged exercise, 30 to 60 minutes a day for 4 or 5 days out of the week, or 40 to 60 minutes a day for 1 or 2 days in a week. And this helped with the diet, and this is kind of all their plan was the whole thing. And then this research was done on 22 women, 11 of which had hormone replacement therapy, and the others did not. They were all postmenopausal by over 2 years or more for the 3-week study. And now if you see here, this is before and this is after, and this is the hormone replacement and the control, which was just the non-hormone replacement therapy. And the sex hormone binding globulin went up, and the insulin went down in both cases. And there was also a significant difference in many of these levels, including weight and BMI. And the article relates sex hormone binding globulin to estrogen levels. The higher you have a sex hormone binding globulin, it will actually lower your estrogen levels because it binds the estrogen and renders it inactive for activity in the breast tissue that could cause breast cancer, from what they said. And so, in their conclusion, they said that this diet should and is possible has the potential to reduce breast cancer in women. They were not conclusive. They did not give a definite answer. And then Campbell cites this article in the China study. He read it off. Increased levels of estrogen and related hormones are a result of the consumption of typical Western diets, high in fat and animal protein, and low in dietary fiber. Now, he says this, but he does not go into the activity factor that went on in this study. And also, he did not have a control group for that activity factor with this study. Well, the study did not. He did not perform the study. And so, I find it hard to understand how he cited this here, because you didn't have that control dose of women consuming a normal Western diet that were doing the level of activity in that area with very minimal stress, I imagine. And they never tested the estrogen levels. He says estrogen specifically, they never tested the estrogen levels. They tested for a sex hormone binding globulin, which is a globulin that will render estrogen inactive. So it does not definitely support China Studies' thesis here, I do not believe, because of that. It did, however, also talk about the insulin level. And there's something with the insulin level, with the meiotic factor, that can also lead to reduced estrogen levels. But here's Kelly.
So the last study that we did was diet and sex hormone in girls, findings from a randomized controlled clinical trial. This study evaluated whether an intervention to lower fat intake among adolescent girls altered their serum concentrations of sex hormones that in adults have been related to the development of breast cancer. So this study really honed in on looking at low-fat diets during adolescence and how it may influence the risk of breast cancer during adulthood. This study was 7 years long. It was done on adolescent girls with an average age of 9. They had 2 groups, an intervention and a control group. The intervention group had a reduced total fat intake of 28%. Their cholesterol was 75 milligrams per 1,000 kcal, and they attended group sessions where they were led by behaviorists and nutritionists, and they were used to direct the girls to reach these dietary goals. And the control group also received nutrition education material from the American Heart Association. So data was collected by 24-hour recalls, nutrient analysis, and blood samples throughout years 1, 3, 5, and 7. And the blood samples looked at estradiol levels, estrogen, estrogen sulfate, progesterone, testosterone, and other hormones. So the results at year 7, the main difference was during the luteal phase, the progesterone was the most significant difference between the 2 groups. The intervention group was less than half the progesterone concentration versus the control group. So in conclusion, these results suggest that reduction in fat during adolescence does result in a difference in serum sex hormone concentrations, and also